EBM, EBP, EIP, EBNP. What's the difference? This is video 1 of the Cultivating Curiosity module. The following slides will advance on their own, but feel free to pause or rewind as many times as you need. We are at step 0 of the evidence-based nursing practice process. And that step is all about cultivating curiosity and creating a culture of evidence. You'll learn more about what that means and what this whole process means as you watch this video. So in video 1, we're going to learn about evidence-based medicine, evidence-based practice, evidence-informed practice, and finally evidence-based nursing practice, so you can understand better what is the difference. You'll learn the basics of evidence-based nursing practice, which is what we use at the Ingram School of Nursing. And you'll learn how evidence-based nursing practice evolved from evidence-based medicine. In 1996, Sackett and colleagues of McMaster University originally defined evidence-based medicine. They called it the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. This is both a methodology and a process. It is divided into 5 iterative steps to answer clinical questions. You're going to learn more about clinical questions and how to answer them in the Ask module. The idea behind evidence-based medicine is that you would use clinical expertise, but also consider the values and preferences of your patients, as well as consult the best research evidence in order to make decisions. And this is important because before this model was proposed, decisions were made based on expert opinion often, and things were done because they had always been done that way. And so this was a shift towards continuing to be curious and to investigate whether the decisions we make for our patients are really the best decisions, and looking for data and evidence to support the decisions that we make about our patients, although we are still using clinical expertise. There are practical steps that you can take to inform the decisions you make based on the best evidence. And these are the 5 steps of evidence-based medicine. You start with asking answerable questions. You move on to searching for the evidence. You then appraise the evidence. And then you integrate that into your practice. And finally, you evaluate that process. So it's meant to be iterative. It's not a straight line. And you want to be self-reflective about this process. And at the center of all that is the patient for whom you are uncertain about therapy, diagnosis, etiology, or prognosis. Now, evidence-based medicine is more than just searching for research articles. There are other kinds of evidence, such as books. These are best for answering background questions, and you will learn about background questions in the Ask module. You also may find hospital guidelines and policies and procedures and clinical guidelines. You can learn more about what the evidence is and how to find it in the Ask and Search modules. It's important to remember that clinical judgment is an integral part of the process, and so are patient values, and that you are looking for the best evidence available. Sometimes a topic has not been well researched, or there are not very good quality articles on a particular topic. But the idea is to at least go to the evidence and see what is there and make sure that you did not miss something important. And identifying gaps in the literature, realizing that a topic has not been researched, is actually an important part of the process. So now, what is evidence-based practice? It's the same 5-step process that we saw that was created for evidence-based medicine, but we're applying it to disciplines other than medicine. And that includes nursing, social work, dietetics, physical therapy, occupational therapy, etc. You name it. Evidence-based practice can be used outside of the clinical context and in disciplines outside of healthcare, such as management, public policy, even librarianship. It recognizes that qualitative evidence is of value, in particular for answering questions about quality of life or experience. You can learn more about what qualitative evidence is by completing the Ask module. All right, so what on earth is evidence-informed practice then? Well, these two are actually often used interchangeably. And once again, the 5-step process remains the same. But some suggest that the use of the word informed instead of based on indicates that the process is more person-centered and rather than focused on the quantitative evidence. And some believe that this provides more flexibility regarding the nature of the evidence and its use, that it implies that many different levels of evidence and types of evidence are needed and used to support decisions in clinical practice. Now, once again, some of this is going to make more sense to you once you've completed the Ask module. Some of these extra types of evidence include case reports, scientific principles, and expert opinion. And again, learn more by completing the Ask and Search modules. So what are the limitations? Well, both EBP and EIP are more inclusive of other types of evidence, such as qualitative and mixed methods evidence, than evidence-based medicine. But they still use the 5-step process, which was not developed for nursing practice, where the development and implementation of policies and procedures and continuous quality improvement is a big part of the process. It does not recognize the importance of cultivating curiosity or the need to develop a culture of evidence. And the barriers to using evidence to make decisions about practice are not really addressed either. There really are a lot of barriers to using evidence to inform practice for nurses, and this study published in 2009 looked at a bunch of other studies that had been published and discovered that there are several different barriers that nurses face on a regular basis, and not enough time is one of them. Not feeling that you have the authority to change things, not being supported in the institution, not being aware of the research, having a hard time finding the literature because it's not all in one place, not having cooperation from doctors, not knowing how to evaluate the quality of the research, not really feeling like the research results are useful in the particular setting where they are, and also feeling isolated from colleagues that are knowledgeable. So evidence-based nursing practice was developed in order to solve some of these problems. It's a 7-step model, and it was introduced as part of a mentorship program, and it was published as a series of articles between 2009 and 2011. You'll find a book that was published about this model on most of the subject and course guides. This process was designed specifically by and for nurses, and it includes the aspects related to continuous quality improvement and change management that are so important to nursing. And it really recognizes the importance of the role of the nurse leader in addressing the barriers that we saw on the previous slide. This 7-step model provides a framework that has as its goal the measurable improvement of quality and consistency of care, patient outcomes, and cost containment. So the idea is that it's not just the individual clinicians that are looking at evidence and making decisions, but that the best evidence is actually integrated into the policy and procedure of each unit. And you have nurse leaders. These can be clinical nurse specialists, nurse educators, or other kinds of nurse leaders. And they are trained in this process. And their role is to foster a culture of curiosity and evidence. They act as mentors, they champion the culture of evidence, they champion change, and they facilitate CQI projects. So here in orange, we have the 2 additional steps. And we still have the 5 steps of evidence-based medicine and evidence-based practice, but now we have step 0 and step 6 as well. So what's new? Well, we have step 0, and that's where we are right now. This video is part of step 0. And the idea here is to recognize the importance of cultivating curiosity and creating a culture of evidence within an organization so that nurses don't feel isolated or discouraged by the people around them and the teams they work with. And then, of course, we have step 6. And that part is what we call knowledge translation, which is that we're taking evidence and we're putting it into practice. And so that includes dissemination of the results of the evaluation. So evaluating our practice is an important part of the process, but also sharing the results of that evaluation. And again, the nurse leader, which is either the clinical nurse specialist, the nurse educator, or another kind of nurse leader, play a really important role in both of these additional steps. So what role does curiosity play? Well, these are some questions that you might want to ask yourself. You can watch the other videos on this module to learn a little bit more about what is curiosity. You can read some of the books about curiosity, and you can take the test to see what kind of curiosity you have, because not everyone has the same kind of curious. But in any case, as you go about your daily life, you may want to think about what is curiosity and how does it relate to evidence-informed practice. What might help you become more curious? What would stop you from being curious? How can you just be open to being curious in your daily life, either as a learner or even just as a human being? And think about how curiosity helps us get comfortable with uncertainty. And maybe also how uncertainty might help inspire you to become more curious. Curiosity really is the key to good practice. It keeps you on your toes and it stops you from doing the same thing over and over without questioning why you're doing it or whether there's a better way. In the Ask module, you'll learn about different types of questions you can ask and how to ask them in a clear way that facilitates searching the literature. If you need help on this curious adventure, Register for a library clinic. Book an appointment with your liaison librarian. Now you can do both from the nursing subject guide, a specific course guide, or the modules. But be sure to complete all the modules before making an appointment because you may find that your questions have been answered.